Hey, doctor, these are the patients who will be calling you today.
Hello? What? No, I can't remember. What? Your mother? Which one is your mother? Wait, hang on, Mrs. Fang. Hello? Hello, hello? 你叫什么名？等一下先。有啦，哎呦，啊 ？No。哎呀 ，hang on 啊。Hello? Hello? Yeah. No. The blue one is enough. One is enough. Chop. Why don't we do it like this? You can join me on a live show where we can chat about this and that. I will try my very best to answer all of your questions. All of your questions answered by this A Doctor. Hey, so come join me on my show on the A Doctor Facebook page. Come and ask me, A Doctor this, A Doctor that. I will answer this, and I will answer that. You. Hello, welcome back everybody. Thank you for joining me. As you guys know, we are live on Facebook tonight. Now, all of you, don't forget to like, share, subscribe, and put comments and send them in, because we have got a very special guest today. Okay, the topic is something that I'm kind of partly to do with me, partly to do with my guest, and it's about, as you know, hormones and cancer. What is the link? Okay, my very special guest is, of course, my friend, Dr. Christina Lai. She's a clinical oncologist where I work, Sunway Medical Center. Welcome to the show, Christina.
Thank you for having me.
Thank
Hello,
you so
everyone.
much. Hello, everybody. Yeah. So if you've got questions on hormones and cancer, start sending them in. Of course, Christina is going to be talking a little bit more about that. Now, Christina, got to get the audience to know you. So, can you tell us 3 interesting things about yourself? And then I'm going to tell you 3 interesting things about yourself.
Okay. So, my full name is Christina Lai Bing.
Okay.
Okay. I'm a clinical oncologist, so I'm a cancer specialist. And the third thing is I'm actually from Sabah.
Okay. All right. Yeah. Which part of Sabah?
Kota Kinabalu.
KK. Okay.
KK,
All right.
yes.
KK all the way.
Yeah.
So the 3 things that I know about you.
Oh, right. Okay.
Actually, one of them you said already. Because when I first met you, I call you Nai Bing.
Yes.
But that's not how you say it.
Yes.
It's actually Ni Bing.
Ni, silent N actually.
Hi-
Yi Bing.
Oh, that one I didn't know.
Yeah. But I think it's Hakka, you see, so maybe
Oh,
it's
So
Ni
then
Bing.
that's another thing about you, lor. Hakangin, no?
Yes.
You're a
Yang Yin,
Hakka Mui. I know that your husband is in oil and gas.
Yes.
Am I allowed to say or not?
Yeah, okay lah.
Can lah. He's a nice guy.
Yes.
Yeah. And I know one thing very funny. When I first asked you to be on this show, you are very quick and very nice to have agreed. Then I think you said you went back and you got a little bit scared. But your husband is so good. He reassured you. And I love this story, right? Because he said her husband went and checked us out and said, don't worry, this guy only got 36 subscribers. So if you make a mistake, only 36 people will see. So welcome to the show and welcome to all to my 36 subscribers, okay? So hormones and cancer, what is the link? Okay, I will hand the floor over to you. It's all yours and
Okay.
educate
Thanks.
our 36 subscribers.
Thank you, everyone. Thanks for having me. So this is a very interesting topic, and I get asked this all the time. So I think it's good to just, explain and talk a little bit about this.
Yeah.
Okay, so what I'm going to cover today is, in the first half of our session, I'm going to talk a little bit about what are hormones actually, and how these hormones can cause cancer. And then the second half, we'll touch a bit more on obesity or being overweight. and how this affect your hormones, and then the link with cancer. And last but not least, we can maybe look at how we can reduce the risk for the general
Yeah.
folks out there. Okay, so let me just start by saying, okay, what are hormones? Alex, this is perhaps your territory, but essentially,
Yeah.
they are chemical messengers in our body, and they function and regulate, control everything about our body. You know, how the body works, how thirsty we feel,
Yeah.
our mood. Okay, so if you look at the picture on the screen there, these are the glands that produce the hormones in our body. So essentially, hormones are chemical messengers produced by organs called glands. So I think most people would know, if you look at the diagram, the most common one that people know would be the thyroid gland. Okay, so that's the thyroid gland there. And then, of course, you have the pancreas, which most people don't know is related to diabetes. Okay, so all these glands work together, and then this network of glands will form a messenger system called the endocrine system. So Alex here is an endocrinologist, a specialist in the how the endocrine system works.
Yeah.
Okay, right. So most of these hormones actually work with a feedback loop, responding to the needs of our body. So here, for example, you know, your body is telling your glands that, okay, I need more thyroid hormones. So the hypothalamus, which is that gland at the top of our head, secretes a hormone, tells the pituitary, which secretes another hormone, and that would stimulate the thyroid glands to produce the thyroid hormones. Sorry, I'm giving everybody a
Overview.
overview,
Yeah, yeah.
more like a biology lesson here. But these thyroid hormones then go do what it has to do, but they also feed back to the hypothalamus and the pituitary and say, okay, we've had enough, you can tone down now. So this feedback loop is very important.
Okay, I'm feeding back now to the technical team that you need to loop to the
Feedback
next
and
slide.
loop.
No,
is-
no, you don't loop so backwards. Okay.
Thank you. Yeah.
Yeah.
So let me just zoom in first. So when we talk about hormones, the most obvious link with cancer is in women. Okay. So in women, our main hormones, the female hormones, as they are called, estrogen and progesterone. Okay. This is produced by the ovaries. So I'll just show you a picture there. So the female reproductive system is made out of the ovaries, the fallopian tube, and then, of course, the womb, the cervix, and the vagina. So the ovaries are the main factories producing the estrogen and progesterone hormone, right? So the main cancers that are affected by these hormones are breast cancer, uterine or womb cancer, and ovarian cancer. And this is because these hormones actually control the rate of the cell division as well as the maturation of the cells. Okay, now let's look at them one by one. Breast cancer. So essentially, breast cancer risk increases due to high exposure of estrogen and progesterone. So anything that exposes you to a high or long duration, basically, of estrogen and progesterone will increase your risk of breast cancer. So if you have your periods quite early, you start quite early, and then you go on and have periods, and your menopause is very late. So that's a very long time to be exposed to these hormones. Then, of course, if you're older at your first pregnancy or you've never having given birth, that's a risk factor. And then, of course, if you had hormone replacement therapy, so in patients who have very bad symptoms with menopause, sometimes they are prescribed this hormone replacement therapy. And also in patients who take the birth control pill, oral contraceptives, these are kind of like artificial and estrogen, artificial hormones, and that exposes the body. Now, interestingly, then childbearing and breastfeeding becomes a protective effect for breast cancer. It has to do with the balance, of these hormones in the body when you are pregnant or when you are breastfeeding.
So, Christina, we already have quite a few questions here.
Okay.
One of them is from Shuai Wei. hello again. Yeah. And she has endometriosis, and she's wondering if there's a link with endometriosis and some of these gynecological cancers,
Yeah.
ovarian cancers,
So
etc.
that's what we're going to talk about in the next.
Okay.
Yeah. So we will, go step by step with each type of cancer.
Can.
Yeah. So okay. So let's look at ovarian cancer next then. Again, similar concept, longer exposure to estrogen. Okay. Again, same thing if you have an early period or late menopause. Some infertility drugs, okay, like clomiphene or Pergono, may increase the risk of ovarian cancer if it's used for long. So sometimes when you're going for infertility treatment, they go in cycles. So I think if you've gone like 3 cycles and above, that may be a bit, that may increase your risk. Right. And again, of course, if you're on the birth control pill, is a bit opposite to breast cancer, because what the birth control pills do here is it suppress ovulation and reduce the exposure to estrogen. So the longer a woman is on the pill, the longer the risk. So I think when women decide if they want to go on the pill, there is importance in consulting a medical professional.
Usually,
Yes. Because then you have to know, what's your family history. You have a high family history of breast cancer. Which is the pill to go for? You may want to choose the combination one. There's a lot of discussion to be had there. Okay, now I'm going to, one last thing is again, protective effect, also childbearing. If you have children, obviously you're pregnant, you have that 9-month rest from ovulation during the pregnancy time. Now coming to the uterine cancer. So similar to breast cancer, longer exposure to estrogen, but here the hormone progesterone actually has a slightly protective effect on womb cancer. So again, I just repeated myself again here. If you have an early start of period and then a late menopause, or you've never had been pregnant again, because I think what happened is when you're pregnant, your hormones kind of shift from high estrogen towards higher progesterone. So that has a protective effect. So if you've never been pregnant, again,
go and get pregnant.
Well, balance out, and So any one with infrequent or no ovulation, so something like polycystic ovarian syndrome, where there's no that balance between estrogen and progesterone. So coming back to the question that was asked just now about endometriosis. So I think the problem is that balance of the hormone. If you have a very high estrogen with your periods, but it doesn't shift to progesterone. When you go through your period, I mean, you'll probably be a better place to say this as well, is that I
don't know when I go through my period.
You don't get period. You don't know how
what do you mean I'm a bad?
Yes,
Okay,
you see, men will never understand. So
true.
The reason is because your hormones, changes with your periods,
Yes, of
your
course.
menstrual cycle,
Yes,
put it that way.
of
Yeah.
course.
So, and of course, in some patients who we know with breast cancer, we treat with the drug tamoxifen. That itself can cause a slightly higher risk of wound cancer. This is because this drug, what it does is it blocks the effect of estrogen on the breast, which is what you want to do, right? Suppress the breast cells, but it kind of divert all the estrogen onto the womb.
Other target sites.
Okay, and of course, again, similarly, if you've been taking the HRT in the form of just estrogen alone, okay, without the progesterone component, that also increases the risk of uterine cancer. Okay, again here, like I mentioned before, the birth control pill does suppress the growth, because it's trying to prevent pregnancy. It suppresses the growth and division of the inner lining of the womb. So I think a lot of the times before we, go for this kind of, hormone replacement therapy, birth control pill, or even going for infertility treatment, it's very important that the doctor who, administer this treatment go through with you.
The pros and cons.
Yes,
Yeah.
and also your family history. Yeah, if you have a very high family history of breast or ovarian or uterine cancer, I think it's very important for them to know that.
Yep.
Yeah.
Excellent. Okay. So I can see, it's like such, there's no one rule to fit them all because, as you can see, the OCP, the oral contraceptive pill, is protective for certain things,
Exactly.
but promote certain other things.
Yeah.
And it's like, I think the one word that kept on coming out was a balance of
Exactly.
everything.
I think that's the thing. Like, I mean, as a woman, you realize that, I want to take the pill. I want to have that, freedom
yeah,
and,
yeah.
enjoy responsibility, that kind of thing. But I think you need to find a balance, like, you kind of have to really think about how long you want to be on the pill for and that kind of treatment. Same with the hormone replacement therapy. You need to discuss with your endocrinologist. Okay, I'm suffering from menopause symptoms. I want to take the hormone replacement therapy. How long do I take it for? Which one do I take? Yeah.
So is it time for questions? Well, we do have a few questions, but anyway, do you have more slides
I think that would be the last one for the first part.
for the first
Yeah.
part?
And the one point I also like to make is just that sometimes women go on these pills and all that, right? And then they kind of like forget to go back to their doctor, and then they're on the pill for like 10 years,
Ever.
15 years,
Yeah,
forever,
yeah,
and then
yeah,
you go, oh,
yeah.
you're still on the pill,
Yeah, yeah.
I think,
So it's important
yeah,
to
just a reminder to everyone that, you need to go back and see your doctor
and make sure that
get it checked out and
yeah.
all that. Yeah.
So I think I think when I was in medical school, also one of the classic examples of high gynecological cancers and breast cancers was in nuns and things like that because
Exactly.
they never
Yep.
become pregnant before,
Yes.
they never breastfed
Yeah.
before.
Yep. That's
yeah,
right.
yeah. So yeah, don't be a nun. Oh no, just kidding.
Have
Okay.
more children.
Yeah, have more children. Oh, okay. Yeah, yeah. So again, we have a question here. Does it count as a family history if it's my mother's sister who had breast cancer?
Yes,
Yeah.
it does. So that's a maternal aunt.
Yes.
Okay, it's not only important to know, who in your family lah, but how old they are, or they
Okay.
were when they were diagnosed.
Right.
I
Right.
think it's also important to know like what type of breast cancer. Without going into too much detail, the different types of breast cancer.
Yeah.
So even not only breast cancer. So some cancers are linked. So breast cancer, ovarian cancer, colon cancer, pancreas cancer. So if you have a family history of that, you have to be a bit aware lah. Your risk of that. Now, obviously, if you have a first degree relative, that's
Super high.
lah. So if your mom, your
sister,
sister,
yeah.
that's quite a high risk lah.
Yep. Yep. Okay. Interesting question. Maybe this one you can help to take first, and then for me, I will back up. Does radioactive iodine therapy increase cancer risk?
I think okay. So anything radioactive lah, basically that goes into your body will increase the risk. So that is why when Japan has that earthquake and the Fukushima plant was leaking, it's critical. Even when we do our radiotherapy to young patients, we would counsel them and said, look, any radiotherapy, radioactive stuff going into your body has got an increased risk of cancer. But I think you have to balance that again. I'm using the word balance here because the dose of the radioactive iodine used really is different for different condition that we treat it for. So if you have a hyperactive thyroid or thyroxitosis, which you're just using radioactive iodine to suppress, it's actually a very, very low dose. Okay, but obviously if you are treating someone with thyroid cancer, or you're treating it a relapse a second time or whatever, the dose will be clearly higher. And in that context, I think it's very important for you to think in this way, that you have to treat the monster in front of you before you worry about that little monster that may appear later.
Oh,
you know what I mean or not? Yeah,
this kind of advice.
Right?
Yeah. This is why I invite you on the show. Yeah. So Sharon, I hope that answers your question. Thank you for the mooncake, Sharon. Welcome to the show. We are kind of steering towards not just gynecological cancers. We got questions about tumor markers, best test to detect early cancer, etc. Are you going to cover that in your
we can talk about that in
later
the end.
on? So Jessie Nightingale, we will come to that. But maybe if you want to move on with
Sure.
your further slides, yeah.
Okay, so I'm going to move on to the second part. Actually, I forgot about the man. I'm so sorry, I forgot about the man.
On purpose one,
No
on purpose
lah,
one.
no
Yeah,
lah.
yeah.
But it's just because men, there's nothing much to talk about lah.
What? Nothing much to talk about. Prostate important, you know.
Yeah, yeah. Okay, so this is why I kind of forgot about men. Ooh. Okay, so in men, the main hormone, of course, everyone know is testosterone lah. Okay, that's what makes you feel, I'm a man. Yeah, but there is actually no clear relationship between testosterone and prostate cancer in men. There's been a lot of research, and it's been a bit controversial. I think no concrete evidence has been found. It's very awkward and a bit funny, when you think about it, because when we treat prostate cancer, the first thing we do is we suppress the production of testosterone.
Yep.
So why is there no link? Yeah, so I think there's a lot of factors involved why a man gets prostate cancer. So not purely on testosterone. So the research is still working on it. So, if we have this talk maybe 5 years later, we may have a bit more data. But at this point, there is not a clear, concrete evidence to say if you have a high testosterone, you get higher risk of prostate cancer.
This is one of the few situations in life where men are more complicated than women.
Exactly.
Usually the woman.
Yes. But it's not unfair, You guys can have all the testosterone in the world and not have a higher risk. Never mind. Okay. Sorry. Let's go on.
That's one of those things. Yeah.
Okay. I'm gonna move on to the second part of our discussion here is about obesity and cancer. Now, I think when you think about obesity, you're thinking someone, wow, really big. But I think being overweight also increases your risk. So being overweight or obese does increase your risk of 13 types of cancer. So I'm going to show you this picture from Cancer Research UK, which basically summarize it all, the 13 types of cancer that is linked to being overweight. So here, the size of the circles actually indicate how, the link itself. So you see bowel cancer is like the biggest, followed by breast, and then you have womb. These are the cancers that are generally associated with being overweight. Of course, you have the smaller ones lah. Like
Hey, myeloma as well. I didn't know that.
yeah,
Oh.
yeah.
Okay.
So myeloma or even meningioma. So that's really quite unusual.
I didn't know that.
Yeah,
I honestly didn't know that. Yeah.
Now, okay. So what happens when you're obese, and how does that link to cancer? So you have this condition where there is obviously like anyone who is overweight or obese will have increased fat cells size and number.
Yep.
Now, you are actually born with a certain amount of fat cells. Okay, so when you eat too much, okay, or let's see if I can get this to work. Yeah. So when you eat too much, so you have more energy input than output. So all this extra energy will be stored, and so now these fat cells obviously become bigger and bigger and bigger, and when they reach a maximum size, they would split. So they don't actually like multiply but because they split, there's a lot more. Then when you have a lot more of these, big fat cells, it starts wrapping around your internal organs. That's what we call visceral fat. Then, of course, you also have this condition, which Alex, you know very well, insulin resistant. So what is this actually? Basically, if you eat a very high carbohydrate diet, right? So this carbohydrate will be broken down, digested, and turned into glucose. So when you have a high glucose in your blood constantly, this would stimulate your pancreas, and the pancreas would produce insulin. That's the hormone you need for your cells to kind of utilize, just take in and use the glucose. So when you have a constantly high insulin level in your blood, the cells become resistant. It's like you buy a toy for your son one day, he becomes very happy. But if you buy a toy for him every day, it's like, it's nothing special.
Yeah,
Right?
all the toys I buy for my children, after a while, nothing special.
Yeah.
Yeah.
So it's the same concept
Yeah,
in that way.
yeah,
So the
sure.
cells, so it's a poor state because your cells are starving. and you are full of glucose in your blood,
Your
but the
blood.
cells cannot use it because
Yep.
the insulin is high and it's resistant to the insulin. So what happens when you have these two conditions? Okay, so this is a diagram also from Cancer Research UK.
Yep.
They do this quite nice summaries. It's the theories lah. So if you have a lot of fat cells in your body, they are very active cells. They're just not sitting there looking cute. Okay, so these fat cells are
Okay.
very, very active and they do a lot of harm.
Cute fat cell.
Cute
Oh,
fat cells.
okay.
So sometimes we're like cute babies. But fat babies, you shouldn't make your babies fat lah.
Okay. No.
But why is it so bad lah? These fat cells. So first of all, okay, here estrogen. Now for women, the ovaries produce about 70-80% of the estrogen. Okay, when you menopause already, of course, the ovaries shut down, your factory shut down. Then that 20 and 30% hormones come from your fat cells. Okay, so even if you're very, very slim, you still have fat cells in your body. Okay, so when you have a lot of fat cells, these fat cells are producing extra estrogen. So this extra estrogen then, like we have discussed, will then stimulate, it causes the cells to
womb, the
multiply
breast,
faster in the breast, the womb, increasing the risk of cancer. Okay? Then the next thing that these fat cells do, okay, is that. So fat cells can cause a high level of insulin, already high, higher again some more, or other growth factors to rise. And these factors then cause cells in your body to divide more rapidly. Okay? Now then, in this, among all living happily together with all these fat cells are these macrophages. The blue cells. Okay, never mind. The blue star-like cells that you see on screen, they are, they're part of our immune system called the macrophage, but they play a big role in inflammation. So these cells in the fat called macrophages, right? They release a lot of chemicals, the inflammation chemicals called cytokines. So all these will encourage cells to divide. So this inflammation, that you see so much in the press about how cancer and inflammation, that link is there. So all this seems to be coming from all the activities by the fat cell. So that is why, being fat or being overweight increases your risk of those 13 types of cancer significantly. Have anything to add to that, Alex?
No, I think you went through it pretty good. Yeah, so I
without
think
being too technical lah.
Obesity we all know is bad for a lot of things lah, heart disease lah, diabetes lah, cholesterol, but cancer as well. I think that's a key message to put out. I think you explained it very well. I mean, as they say in that little box right at the bottom, there are other theories as well lah. But I think these are three big theories that definitely link it all up. Yeah, so definitely. Staying healthy, losing weight if you're overweight, obese, definitely will not only reduce your heart disease risk, etc., but it will also reduce your risk for cancers, your 13 type of cancers. Okay, cool.
Okay, so now what can I do to reduce my risk? So I've just put up this slide, just a very broad and general summary lah. So. High hormone level causes in our body. Of course, there are some that we cannot control. Like, for example, you cannot control if you are having any of these disorders, thyroid problems, or your genes, if you, born with whatever genes you have, you cannot control that. Of course, there are other causes that may cause a high hormone level, like pregnancy, breastfeeding, your menopause, age. I mean, you can't change much about that, to be fair, right? But the lifestyle factors you can most certainly change. So stress, obesity, smoking, and caffeine. And again, of course, we spoke a lot about this, the medication side of things, like hormone replacement therapy and other medications. But this is a very good summary. Okay, I think this is my last slide. It's a very good summary, again, by Cancer Research UK. There's a lot of good information in there. How you can reduce your risk. Now, the top line says 4 in 10 cancers can be prevented. So, of course, things like, if you go through the list, don't smoke, keep a healthy weight. I think we stress that enough today. Be safe in the sun for skin cancer. But I think more like, how drink less alcohol, eat a high fiber diet,
Yep.
and of course breastfeed if possible, be more active, and of course minimize HRT use if you can. So I think most people actually know all these factors. It's just being disciplined enough to put it into practice lah. And I think most people say, doctor, how can I lose weight? I drink water also, I can gain weight one. I'm sure you hear that all the time.
Not only drink water, I see food also, somehow I gain weight. Yeah.
Yeah. So I think the key point is, make more changes to your lifestyle lah. Cut things here and there, little bit by little bit, and eventually it will add on lah.
I mean, I like this. Kudos to Cancer Research UK. It's really makes it easy, lor.
Yeah.
Colorful, and then the bigger the circle, the bigger the factor. So right at the top, don't smoke, keep a healthy weight. I think this is certainly very useful advice. And I think I eat lots of processed meat, terrible. Yeah.
I mean, that's the thing with our modern active lifestyle, isn't it? Yeah.
We kind of
Convenience, quick.
Convenience, not so much fiber, etc. Okay, so Christina, I do have a question from Jessie Nightingale. Right, Jessie, do you miss Dr. Christina? How accurate are these tumor markers in the blood screening packages offered by lab, and what are the best tests to detect cancers at an early stage? So two questions. One is a very broad question, what are the best tests to detect cancers? And one is a question which says, am I wasting my money doing tumor markers?
Okay, I think this is a very good question, gets asked all the time. Now, first thing to say, there's no best test to detect any cancer, to be fair. Now, cancer markers are useful tools, but they are not everything.
No.
So most of the time, patients ask me, is there any point in checking the cancer markers? I would say yes and no, all right?
Okay.
Why? Not all types of cancer will secrete something in the blood for you to check.
Okay. Yeah.
So those are basically chemicals. Your cancer markers are chemicals produced by your cancer cells, released into your bloodstream. So not all types of cancer will. Let's pick an example. For example, the more common cancer marker is the CEA, which is what we check for colon cancer, right? But 20% of colon cancer have a normal CEA, right? So then what's the point of checking? But I think in some cases where, patients go for a health screening, package includes the cancer marker, we check something, it's a little bit high. And then when we investigate further, we found a small lump in the lung or in the colon or whatever. And then you get to pick that up quite fast, an early stage. So I think if you are going for a routine health screen and it's part of your package to do the cancer markers, do check it. You never know, you may be one of the lucky ones. Well, lucky lah. I use the word
lucky.
Lucky
we know
or
what
unlucky
you mean
lah.
Yeah.
You are the lucky ones that
unluckily lucky.
Yeah, well, unluckily
Or
lucky
luckily
that
unlucky.
your cancer does secrete that cancer markers. Early high, it was picked up, and you found that it was a stage 1, and you can be easily cured of that cancer. So I think, I tell my patients, if you are doing a health screening, you're doing routine everything, blood test, cholesterol, glucose, and part of the package is to check it, why not? But don't hold it like gospel truth, you know what I mean or not? Like, I have this pain and my cancer marker is normal. It cannot be cancer lah, never mind, ignore it. You know what I mean or not? So even if you have a normal cancer marker, your symptoms are persistent, you've been having this cough, this pain for whatever, for weeks.
Follow up on it, lor.
Get it checked,
So, okay, I think that's a great answer because it provides a lot of clarity about the utility of it lah. So hope that helps. And absolutely, there's no best test to detect.
My advice to patients when they ask is like when patients come and see me, the relatives will ask, I should go and get a check. I think your annual health screening is good enough. Okay, obviously, if you have heart problems and you're doing more regular checks for that, why not? But I think as a healthy person, perhaps you should look into doing, getting into active lifestyle and maybe just doing your annual.
Yeah, I think sometimes the simple basic things that, say for example, pap smears,
Mammogram for women.
the things that we normally advise
Yeah.
people to do.
Yeah, it's just like how for men, now, okay, to be fair to men, okay, we'll come
You're
back.
so unfair to men. Yeah.
To be fair to men, one of the things that gets thrown in for all your health screening is the PSA, which is the prostate cancer marker.
Yeah.
Okay, so majority of the prostate cancers, to be fair, have a high PSA reading. So it's definitely worth doing it. But then you still have that 5 to 10% of prostate cancer that the PSA is normal. So
Nothing is ever perfect.
nothing is 100%. Yeah.
So yeah, I think it shows, our line of work, how sometimes we need to really individualize, and not only that, we need to try to cover all angles, because I really like in the beginning when you summarize each and every one of the cancers and sort of say that, hey, look, OCPs can increase this, but it can decrease this. Pregnancy can increase this, but it can decrease this. So, that's why it's difficult, and it has to be individualized as well. Okay. Do you have any sort of other general final thoughts for our viewers tonight?
Well, I mean, we're talking about cancer, and then I think we've touched enough about the healthy lifestyle thing. But I think the main message that I try to get out when I get on any opportunity to get this out is tell patients that, even if you're given a diagnosis of cancer, okay, it's critical, of course, to catch the cancer at an early stage. So that's why we encourage, which we've done, is to do your health screening. Because like pap smear, mammogram, you can pick up these cancers at an early stage. And it's highly curable. So getting a cancer diagnosis is not
end of the world.
It's not a death sentence anymore. I think with modern medicine now, and in oncology, it's very challenging, and it's also very exciting times now because we get so much. We get so much advances going on, so many research. So things have changed. Even patients, when I tell them you need chemo, they freak out. But then after they've gone through, they say, hey, doc, it's not too bad. So that mindset kind of need to change. So just to encourage everyone about that.
I would say that would be a nice way to end it, to talk about treatment as well, because it has changed.
Yes.
A lot of people, I think, out there, when they hear the word chemo, the first image they get is somebody who's bald, lost all the hair, and then looks like half dead. But actually, many chemo patients nowadays, we have these very targeted therapies.
And we have gotten a lot better in supporting our patients through the treatment. So our anti-vomiting drugs have come in leaps and bounds. Most patients may not even vomit or just mildly out, no appetite, that kind of thing. So we've got a lot better. There's drugs to boost their immune system and all that. So it makes a lot of difference nowadays.
I think that's a great way to sort of wrap it up, to sort of say that even if you do get cancer, I think the treatments nowadays are pretty advanced, and we can see that people are surviving for much longer with less side effects.
Absolutely.
Maybe the only side effect is the bank account will slowly die .
I mean that's the price to pay in the sense that with all this new and fancy targeted therapy.
Targeted at the bank account.
Yes. Go straight to it. That's the other downside .
That's the other downside.
What to do?
So the nausea that they get is not from the.
When they look at their bank account.
Look at the bill.
Terrible.
Okay. No. Just kidding. Of course, there are some pretty basic things also, things like androgen deprivation therapy, living a healthy life. That one doesn't cost you money, ma. Okay. So again, thank you so much, Christina. And in order to thank you, I have got a gift for you.
Oh, thank you very much.
It's your own personal A Doctor t-shirt. So you can take it home and wash it and give it to your mate, or if you don't like it, or you can wear it .
Thank you so much. Thank you for having me tonight.
And I got 2 for you. Actually, I tell you something. This is a S, this is an M, and then there was supposed to be an L. but I'm wearing the L. You know why? Because I used to wear an M, but I went to Singapore for holiday. Then when I
Oh,
came
you
back,
came back as L lah.
I came back as a L.
Well.
I went as a M, I came back as a L. So here's your
Thank
your
you so
t-shirt.
much.
Okay,
Thank you
so
so
thank you
much.
very much, and thank you to all of you. My next episode is going to be on something slightly different. It's going to be on osteoporosis, how bones and hormones and groans and moans and how to stay strong and hard into your old age. 28th September 2022, Facebook Live 9 p.m. See you all at the next episode. Goodbye.
Bye.
Bye.
Take care.
Good night.